So when you moved from a teaching hospital into a corporate ecosystem, how did that change work for you? And how did you manage a dual practice kind of thing when you had your own OPD along with the corporate job?
There are two kinds of corporates. In Bangalore, I'm sure it's the same scenario everywhere. There are corporates which encourage you to have your clinic also, and there are corporates who discourage you to have your clinic. There are certain corporates, if I can name, can I name?
Yeah, sure, sir.
Yeah, sure.
Okay. Like in Bangalore, you have Aster. Aster will discourage you from having your clinic. So if you have your clinic in an interview, that's a negative point for them. And they might even ask you if we like you, but we don't like you having your clinic. If you shut down that clinic, then we'll take you on board. I work in Fortis right now. Fortis encourages its surgeons to have their own clinic so that the hospital, you don't eat from the hospital only. You bring in some patients from outside also into the hospital. So I'm in a hospital, and about 70% of corporate hospitals are like that. They don't mind you having your own clinic. That way, you can build your practice also. I'm in a hospital where I'm the only orthopedic surgeon. It's a small 55-bedded hospital called Fortis Rajajinagar. There are a lot of hospitals where there are 3 units. So your OPD will be on day 1 and day 4. What do you do in the other 2 days? So other 2 days, at least you can practice and try to get in some more surgical load into the hospital. So a lot of hospitals actually encourage you having your clinic, and it is very useful. The first thing I was taught when I came to Bangalore is start your clinic. I told you that I joined as a registrar in 2012, immediately after finishing my PG in Apollo. All the consultants there encouraged me to start my clinic, which is what I encourage all my juniors also. Whenever you have finished your education, you come back and set up your practice, you should start your clinic, maybe in the second year. First year, you scout. If you start your clinic, then that's a commitment that you have. You got to sit there. Okay. If you don't sit in your clinic, then you will not succeed. So in 1 year, if you don't have a clinic, you can roam around a lot of hospitals and try to develop more contacts, try to get more cases. Then you zero in on a particular area. Okay, this area has less orthopedic surgeons. This area has population who are amenable, who will agree for a surgery. So you zero in on the area, and second year you start your clinic. But a clinic has to be there for anyone who is in a corporate hospital or in a medical college, if your medical college allows it.